Welcome back. Anyone who is active and on their feet is a potential candidate for this problem. Joining us this morning to discuss plantar fasciitis, Dr. Andrew Elliott from Gundersen Health System. Dr. Elliott, thanks for being here.
Well, thank you. Good morning.
Good morning. Tell us a little bit about this issue. What exactly is it?
Sure. Plantar fasciitis is an extremely common problem. There are approximately 1 million cases diagnosed each year. Any sports fan is probably familiar with the term. Usually somebody during the season gets a case of it. Peyton Manning is probably the most famous recent sufferer. But what it is essentially the plantar fascia is a band that runs from your heels to your toes, and its job is to support your foot, your arch. And plantar fasciitis is any inflammation of that band, whether at the heel at its insertion or at the toes.
Are some people more prone to it, more use, for example?
Absolutely. There tends to be a female gender disparity, tend to be middle-aged, people that are obese, that have a sudden change in activity, that have an increase in use, anything that causes increase in use.
I'm assuming it's quite painful. Thankfully, I haven't had to deal with the issue, but what are some other signs that you might have it?
Sure. The classic symptom is pain when you first get out of bed in the morning right in your heel. So you get, some people describe it as stepping on a rock or a nail or something like that. That is a classic presentation. Pain after you've been sitting for a while. Okay,
and there are some ways to sort of self-treat it, maybe stretches. What are those?
The best way to treat it is to stop the actual activity that's causing the problem. Now that's usually your job, so that's not very practical. So we treat it in a couple of other ways. We offload the area, typically with orthotic stretching, taping, strapping, things like that. If that doesn't work, then there's physical therapy, ultrasound, shockwave therapy, and then also people get good relief with a steroid injection. 90% of people get better in about 9 months. That still leaves 10% that don't. Surgery is an option for them, and we do that endoscopically here, and that involves two incisions in the heel. We insert an instrument in those incisions, release the plantar fascia, and that's the surgical procedure. Yep.
Okay, so there is a way to eventually get relief, but hopefully those minor sort of stretches can help at least for the time being.
Exactly right.
All right, Dr. Elliott, that's all the time we have this morning. Thanks so much for joining us.